everybody. We still got some people signing in here, so we'll just give it a minute, let them catch up. While we're waiting for them, this is going to be recorded, so anybody can request to see it played back. That's not a problem. We'll go ahead and dive in. I'm your host, Loran Marmes. I'm the bald guy in the picture there, and I'm a Medicare supplement agent with Medicare Solutions team. I am the owner of the company, also owner of MedigapInfo.net, which is our website. It's currently in a little bit of disarray on our website. We're combining. I had 4 websites for every part of the country for the coast, and I've made the decision to put it all into one that is just a common place for everyone to go. And I think all the visitors will be very happy with the results. It's still there, it's functional, but we're still adding every day to it. So please be patient with that. Also, when we redid our website, we redid our YouTube channels. Again, having various videos explaining Medicare supplements, Medicare Advantage plans, Part Ds, and all the other moving parts for all the different channels that we had. We decided we're moving again into just one location. It's Medigap TV on YouTube, and I think you'll find it very informative. Take a look at it, look over it again, that we're adding every day to it. So before we get too deep into Medicare, we're going to do a little housekeeping. I have comments turned off because this is going to be recorded, and just to keep it so while it's live, I'm not distracted from questions being asked here. You're going to see this on the right hand of your screen. You can still type your question in here, send email, and it will come directly to me. I will personally answer all your questions, and it's just worked better for us in our other webinars. The reason we went to this webinar system is we found scheduling to become very difficult. People are busy. They're still working usually when they're 64. Today's society is constantly moving. So this way, with the webinar, you can do it in your home. With us recording this webinar, you can do it anytime that's convenient to you. You can sit back, relax, and watch the webinar and learn. Now, if you're turning 65, this is about what your mail looks like. If you keep it on the table or in a room, you're getting lots of junk mail about 6 months to 7 months before you turn 65. You're getting all this, and it's hard to decipher. There's companies trying to advertise to you, hey, this is from Social Security, and it's not. If you look at the bottom, it's from an insurance company. I'm an independent insurance agent. I personally carry 20 different companies, so if you do need help choosing a Medicare supplement and you find our information useful, I would love the chance to quote on your product and discuss it with you. That's enough for the sales talk, but we want you to step away from the junk mail. Just walk away from it. There are 2 pieces that you're going to receive that you do want to keep, and I want you to look out for them, okay? The first piece is the Medicare and You booklet. It is the official U.S. government Medicare handbook. This is straight from CMS, who runs Medicare. CMS stands for the Centers for Medicare and Medicaid Services. It has a ton of useful information in it, and most of my videos, I reference it directly. I have one in my vehicle. I have one on every desk, and every one of my agents has a copy at their desk. Do not throw this one out. The second piece is if you're on Social Security already, they are going to mail you your card about 90 days out. If you don't receive it, and I've seen this happen, there's a problem. You want to call Social Security and find out what the holdup is. If you're not receiving Social Security and you're going to put it on hold to say you're 66 or 67, or you just haven't started it yet, you will need to set up a meeting with Social Security to start your Medicare. Again, if you're on Social Security, they will send you this card. If you are not on Social Security, you need to enroll. And I'll go through the enrollment process here as we go along. Okay, so if you do need to enroll, when should I sign up for Part A and Part B? The rules are, when you're first eligible for Medicare, you have a 7-month initial enrollment period to sign up. I don't recommend, and in fact, I don't know anybody that does, that you hold off to the end of that initial enrollment period, because you could end up without coverage, or you could end up forgetting about it and going outside your open enrollment. Then you end up with fines and penalties when you finally do enroll it. It's just better off to get it done right at the beginning, and that way you can have your Medicare supplement in force when your other insurance goes out. It starts the first of the month, the other one ends the 30th or the 31st, and you're ready to go. For example, if you're eligible for Medicare when you turn 65, you can sign up during the 7-month period that begins 3 months before the month you turn 65, the month of your birthday, and ends 3 months after your birthday month. Okay, and we're going to give you an example of that right here. Let's say your birthday is June 15th. Even though it's in the middle of the month on the 15th, your Part A and B, when you turn 65, will start on June 1st, okay? So it doesn't matter what day of the month your birthday is, unless it's the 1st, and that's a whole different scenario. If your birthday is any other day than the 1st of the month, it will start on the 1st of the month. So if your birthday is June 15th, you will actually be able to start applying for Medicare in March. Okay, you'll have the 3 months, March, April, and May before, the month of, and July, August, September, the 3 months after. I highly recommend that you start it as early as possible. In February, call to make the appointment, get in March, get it started. In some states, you can buy a Medicare supplement 6 months prior. Some other states are 3 months. It is a state-to-state issue on when you can purchase a Medicare supplement. But as far as actually starting your Medicare, it is the 3 months before, the month of, 3 months after. Okay? So now that we've got the enrollment process down, and again, any questions, type them in the box there, hit email, and they will be sent over to me, attached with your email, and we'll get them answered for you. If you want a phone call, no one else can see it. Type in your question, and please call me. Put your phone number in there, and we'll give you a call. Time of day would be good if you want it morning, afternoon, evenings would help too. So now we're going to take a dive into the parts of Medicare. What actually is made up of Medicare, what parts come directly from Medicare, and what parts are from an outside insurance source. Okay, let's dive in. Medicare is made up of 4 parts, but only 2 of them come directly from Medicare. Part A, hospital insurance. Part A covers your inpatient hospital stays, stay in a skilled nursing facility, hospice care, and some home health care. The next part is Part B, which is your medical insurance. It covers your doctor services, outpatient care, medical supplies, and preventative services. These 2 out of the 4 parts of Medicare are the only 2 that come from Medicare directly. When you get your Medicare claim card, it will say Part A effective date, Part B effective date, and that you are enrolled in both of these. The other 2 parts of Medicare, which both of them are sold by independent insurance companies, Medicare Part C, which is actually Medicare Advantage plans, or MAPDs, or MAs sometimes they're called. They are basically a private insurance company administering your Medicare. And then we have Medicare Part D, which is your prescription drug coverage. While you do not have to have a Part C or Medicare Advantage plan, in fact, we advise against it. We advise that you take a Medicare supplement along with A and B. You do have to have a Part D for prescriptions. Part D prices vary by company. They also vary on what drugs are carried on your formulary. Okay, so for Part A, usually is zero premium, and that is if you or your spouse paid Medicare taxes while working. This is sometimes called premium-free Part A. If you would pay for Part A, as of this year, 2016, it would cost you $411 each month. Part A covers hospital care, skilled nursing facility care, nursing home care, as long as custodial care isn't the only care you need. You need to be in a nursing home for something other than just custodial care, rehab or something of that nature. Hospice care and your home health services. Now, Part A has a deductible of $1,288. Please note that it's for each benefit period. This is not a yearly deductible. This is for each benefit period. And the benefit period starts when you're admitted to a hospital or a skilled nursing facility, and it ends when you have been discharged and 60 days later. So if you went into the hospital for a 3-day stay, you were discharged. 60 days later, you would start a new benefit period. In reality, if after 65 days after the initial hospital stay, you had something else go wrong and you were admitted again, you would have to pay that deductible again because it's benefit period. Part B premium is $121.80. This is normally what it is. If you had higher incomes, this could go up by income. If you were on Social Security and Medicare before 2016, you are still paying the $105, and that is because they cannot raise your Medicare rates when they didn't give you a Social Security raise. Part B also has a deductible. You will pay $166 per year for your Part B deductible. Again, this one is per year. So that's it. It's the first $166 for your doctors or medical equipment. Part A and B also only pay 80%, which means you will have a 20% copay. To cover that 20%, because there is no maximum out-of-pocket, and your deductibles, that is where a Medicare supplement comes in. Although the Medicare supplement plan that we recommend, Plan G, you will pay this out-of-pocket. And see our video on Plan G to explain why that makes sense. Medicare Part B covers services like lab tests, surgeries, and your doctor visits. It also covers supplies like wheelchairs, walkers, or oxygen. Part B services are broken into two categories: medically necessary services, which is something that you need to diagnose or treat your medical condition, and preventative services, such as flu shots or mammogram or a colonoscopy. You'll pay nothing for most preventative services, although they do have a schedule and certain conditions on when you can get them if you're high risk or normal risk. It also covers clinical research, ambulance services, durable equipment, which is, again, your wheelchairs and things, mental health visits, some inpatient coverage. It will cover all your outpatient coverage and partial hospitalization. If you need a second opinion before surgery, that will also be covered under Part B, along with some of your outpatient prescription drugs, such as chemotherapy drugs. Part C is a Medicare Advantage plan. You do not lose your Part A and Part B of Medicare, but your Medicare will be administered by a private company that is approved by Medicare. You will have networks, you'll have co-pays. The one thing that a Medicare Advantage plan has that original Medicare does not is that it has a maximum out-of-pocket. Again, we recommend them against the Medicare Advantage plan if at all possible, and to go with a Medicare supplement. Again, the Medicare Advantage plan does not come with your Medicare card. This is sold by a private insurance company. Part D. Part D is your drug and prescription coverage. It is also sold by private insurance companies, but you must get your Part D. If you do not, there is a fine for every month that you were eligible that you didn't have it that will be added on when you finally do get one. And let's face it, we don't get healthier as we get older. Someday you're going to need one. The plans vary greatly by price and by what drugs are in their formulary. So you want to take a look at all of your prescriptions, make sure they're in your formulary before you make a decision. And again, I have a separate video on Part D and how to get the best one for you. Okay, so I hope that explains in plain English the parts of Medicare and what each one of them does. I know I went a little fast. I'm trying to keep this as short as possible. If you have any questions, please send them to me. We'll get them to you. We'll get them all answered. In conclusion, Medicare pays 80%. After your deductible is met, you typically pay 20% of the Medicare approved amount for most doctor services. What the Medicare approved amount is, Medicare has set amounts for every procedure. For instance, if you went to a doctor that says, I charge $1,000 for this, Medicare says, no, hold on a minute, we only approve $500 for that procedure. The doctor, if he is assigned by Medicare, must only charge you that Medicare approved amount of $500. In summary, your Part A is going to cost $0 for most people. Your Part B, if you're new to Medicare and Social Security for 2016, will cost $121.80. If you were on Social Security and Medicare before, it will revert back to the $104.90. And I just want to make something very clear with this Part B premium. And I get it almost on a daily basis. You aren't buying Part B from anyone else. No one can sell you a lower cost Part B. Part B is part of Medicare, like we explained earlier. The cost is what it is, and it is a death do us part type deal. You will pay it for as long as you have Medicare. Your deductibles are $1,288 per benefit period. Remember that, per benefit period for Part A. This you want covered by your Medicare supplement. Part B has a $166 per year deductible, and that one you want to pay out of pocket. I know you're probably thinking to yourself, Loran, why do I want to pay that? Well, you want to pay that because in the long run, it will cost you way more than $166 a year to have the insurance company pay it for you. Please see my Plan G video on that. Again, that's at Medigap TV on YouTube. It's under Best Medicare Supplement Plan. Now, coinsurance, like we just discussed, that's going to be 20% of all Medicare approved. You want that also covered by your Medicare supplement. Thank you very much for attending. I hope this answered a lot of your questions and you found value in our webinars. If you're watching this live, you can find a copy of this that's been edited. I take out some of the stutter parts on our YouTube channel, Medigap TV, so you can go back and watch it and you can pause it at any time you want. Again, we're here for any questions. Just give us a call at 844-528-8688, or, like I said before, even if it's in the recorded version, you can type in down in that yellow box your question, hit the email button, and it'll come directly to me. Thank you, and we hope to hear from you soon.